Imagine being a 29 years old, active and healthy, and suddenly losing your ankle to a severe fracture. For most patients, the only option is a fusion surgery, which means the ankle will never move again. But today, I want to share with you a different story. How we replaced the entire talus bone with a custom 3D printed titanium implant, and gave this patient back his ability to walk, run, and live normally again. Hello, welcome back to our channel. I am Dr. Bomsoo, an orthopedic surgeon specializing in foot and ankle surgery. I am pleased to present a novel surgical option for a severe ankle fracture: total talus replacement using a 3D printed pure titanium implant. Indications and contraindications. Total talus replacement, or TTR, is indicated in cases of primary or post-traumatic avascular necrosis and in comminuted talar fractures with intact or relatively well-maintained adjacent joint surfaces. Contraindications include active infection, severe soft tissue compromise, and poor vascularity of surrounding tissues. Case presentation. Our case involves a 29-year-old man who sustained a comminuted talus fracture associated with a dislocation of the short part joint and a distal tibia fracture with damage to the tibial platform. At the first hospital, an external fixator was applied with a staged pantella fusion planned. The patient visited my office 3 weeks after the injury, still in the fixator. He came searching for another option to salvage his ankle joint. He was a young and active man, and to him, pantella fusion felt like losing a part of himself. So we decided to salvage his ankle joint using a customized 3D talus implant. A mirror image of the contralateral talus was used to design the implant, which was then 3D printed in pure titanium. The implant was ready within 1 week for a prompt surgery. Surgical technique. Content warning. Surgery scenes will appear shortly. If you prefer not to watch, please skip to the next section. I'll see you after the surgery. First, the external fixator was removed. The short part joint remained dislocated and the ankle was very stiff. Through an anterior approach, the comminuted talus and fracture fragments were completely removed. The bone fragments were mosellized and used as autologous bone graft to fill the defect in distal tibia. And the partial cartilage defect was covered using bone marrow aspirate concentrate and a collagen matrix. Finally, the customized 3D printed titanium talus was inserted, restoring smooth and full range of motion. Outcomes. Post-operative radiographs confirmed precise alignment and good congruity of the implant and adjacent auricular surfaces. At 3 months, the patient was walking, even lightly jogging, without pain. And at 6 months, he was back to his normal life with excellent function and minimal discomfort. Unfortunately, at the 14-month follow-up, osteolysis was observed in the original bone defect site in the distal tibia. The defect had initially been filled with fracture fragments that were 4 weeks old at the time of the initial surgery, but these did not incorporate well and resulted in osteolysis. A minor revision was required. The cyst was curated and packed with autologous iliac cancellous bone graft. This revision allowed us to have a second look arthrotomy at 14 months after implantation. The joint appeared nice and clean without any metallosis or inflammatory reaction. Importantly, no implant wear or cartilage wear was observed. Broader outcomes and literatures. In our clinical series, patients undergoing TTR have shown substantial improvements in pain and function with no failure and no implant removal to date. These findings are consistent with recent literatures supporting total talus processes as a reliable salvage option with durable results and high patient satisfaction. In conclusion, TTR with a customized 3D printed pure titanium implant offers a safe, reproducible, and highly effective alternative to fusion in selected patients. We believe this technique has the potential to expand surgical options and enhance outcomes for patients with severely damaged talus. Thank you very much for your kind attention.